number 10, titled Botswana COVID-19 Response by the Honorable Minister's Address. My name is Ronzitsi Semoro. I work for the Ministry of Health and Wellness, and I'll be your. And first, I want to highlight that this webinar is co-organized by Ministry of Health and Wellness, Rutgers University, and University of Botswana. Before I hand over to my colleague to introduce our presenter for today, let me take you through the webinar housekeeping rules. First, please mute your microphones. Ask questions using the chat function. A moderator will monitor the questions, and some of the questions will be addressed during the presentation or during the question and answer session. Some of the questions have been sent during registrations, and those questions are going to be addressed also during the presentation or during the question and answer sessions. The session is going to be recorded and can be accessed on YouTube. All our previous sessions are available on YouTube. You can just check Botswana-Rutgers University partnership. And we will send the link also on the chat box for the previous sessions. So now I'd like to hand over to Dr. Pusane to introduce our presenter for today.
Good afternoon and welcome to our 10th webinar. My name is Dr. Pusane and I'll be doing the honors of introducing our Honorable Minister. Dr. Lemogang Kwape is an area MP for Kanye South constituency in the southern part of Botswana and was appointed as the Minister of Health and Wellness for Botswana in November 2019. He holds a PhD in epidemiology from University of Aberdeen, Scotland, a master's degree in public health and epidemiology from Wageningen University, Netherlands, and a bachelor's degree in dietetics from Texas Southern University in the United States of America. He's an administrator of note. Honorable Dr. Minister Kwape worked as the head of nutrition and dietetics as the National Food Technology Research Center, NAFTEC, Botswana, where he spent 19 years of his career. He is also, due to his professionalism and effectiveness, he is a board member in several leadership positions in BIH, Botswana Innovation Hub, as a board member, Botswana Vision 2036 Council, National Food Technology Research Center, NAFTEC, as a board member as well, and the chairperson of NAFTEC Corruption Prevention Committee. He is confident, versatile, accountable, innovative, decisive, committed, and a visionary leader who values Botho, which is the social contract of mutual respect towards each other, and believes Botho is an integral part in excellence service delivery. His vision is to assist in advancing Botswana to a more prosperous and inclusive socio-economic development. As a new legislator, Dr. Kwape is committed to significantly participate in the national development agenda and ensure creation of sustainable jobs for Botswana, especially the youth, and provision of quality health care for the nation. He is married and is blessed with 2 sons, and we are truly led. Thank you, Minister.
Thank you very much, Dr. Katsu, for the kind introductions. Let me start by thanking the moderator, Dr. Sisimoko, for organizing this webinar, and also thank the partners, Rutgers University, University of Botswana, as well as the Ministry of Health and Wellness. From the outset, I must say that I'm thrilled to be participating in this webinar and giving an overview of Botswana COVID-19 response update. I'm going to take you down the memory lane of where we started as a country and share with you some of our achievements and challenges as we deal with this pandemic. As we are all aware, the COVID-19, then Corona, was first announced late December 2019. And we caught wind of it, like everybody else, from the media. And as a responsible country, we sprung to action. And I'm going to take you through the chronology of events on Botswana's response to COVID-19. In January, the ministry alerted the nation of the unknown virus. At the time, it was corona, and we started screening. And this was a very mundane screening at the ports of entry. We just checked temperature and asked questions such as if people have interacted with people who may have been who may have contracted COVID, or they have been to countries who are at high risk. We also activated our national response at the national level as well as at the district level or local level in our country. And we also formulated a plan in February of the same year. And we had our first case of COVID-19 late March. And we immediately declared a public health emergency. And this was done at the ministry level. We also imposed a 14-day mandatory quarantine. So every returning citizen or resident was asked to quarantine for 14 days. And then the president also appointed a task force, which he chaired. And in April, as we progressed, His Excellency the President, Dr. Masisi, declared a public health emergency. And immediately we went into what we call extreme social distancing. And towards the end of April, May, that was lifted, and then we divided the country into zones. We also recently just locked the city of Gaborone because we had an eruption of suspected cases. So we acted with speed so that we can check the spread, if any, of the virus spreading into other parts of the country. And as I indicated, the president, the lead, is the head of state. And that is extremely important in terms of our approach to fighting this pandemic. He is at the helm, assisted by his cabinet, as well as officials from the different ministries in his government. He's also appointed a coordinator who's overall in charge of coordinating all the COVID-19 activities at a national level. This has been cascaded also to the districts, where we have the same setup in terms of our response to COVID. We've even taken it down to the village and towns, so where we have the same system, and they all feed on to the national task force. In terms of our plan and preparedness, we've done it in several ways. The most critical one was the coordination, building capacity, ensuring that we are prepared, and strengthening the coordination in general of the COVID-19. We also looked at the surveillance system. As I indicated in my opening remarks, we started screening at port of entries, and later on, with assistance of WHO, we started building capacity to test locally in the country. I must say right from the onset that at the beginning, we were testing at the only lab in this side of Africa, which was in South Africa, the NICD. But over the time, we built our own capacity, and now we do test locally in at least 5 places across the country, because we believe that early detection of people exposed to corona is of paramount importance. As I indicated, we were supported by WHO. They trained people on all the protocols. And then the other key thing was, because we had reported cases in late March, we also kickstarted our case management. So we identified places around the country where suspected cases and confirmed cases could be isolated and treated. And we also ramped up our infection prevention and control. And this was extremely important because this is a new disease, very unknown. So we were learning as we were going. And we started off with the mundane things like washing hands with clean water and soap, or using sanitizers, wearing masks. This does not sound like a lot of work, but in terms of preventing COVID, they really seem to work. And I'll talk to that as I proceed in my presentation. Port health was also of extreme importance because most of the cases were imported cases. So we had to ramp up our vigilance at the port of entries. So we had people there who were trained, who could test at the port of entry, isolate people as they came in. We also opened up green lines. As you may be aware, Botswana is a landlocked country, so we depend on other countries to get our supplies into the country. So the borders were critical in terms of managing the inbound cases of COVID-19. The other critical thing that we did, and we did this tirelessly in the country, was communicating the risk. We were on radio, online, on television, day in and day out, getting the message to the public and raising awareness so that we can be ably detect and respond to concerns of the citizens, as well as quell any rumors of or misinformation. The other key thing that we embarked on in terms of our plan is logistics. We really needed to get the materials in country. And it was very difficult because most of the supplies for COVID-19 were rationed the world over. And Botswana being a small population, we only ever got a very small size of the pie. But in terms of numbers, cumulatively at our port of entries and within the country, we've screened well over 340,000 people. And remember, Botswana is a population of about 2,200,000. And of these, we've tested using PCR over 33,000. And only 79 people tested positive. And I must here add that the vast majority of them were those who were coming into the country, bringing in our supplies, and almost 50 of them have been repatriated back to their country. 25 people have recovered. We only have 4 active cases in the country. We have 1 case who unfortunately demised. But in terms of achievement in the way we manage COVID-19 in Botswana, we've been very fortunate because there was political will. His Excellency, the President, led from the front. And I think this was extremely important dealing with this novel virus. So we had the head of state who was in the driver's seat, and his cabinet was playing the supporting role as well as the officials in the background. We're working very hard day and night to make sure that this disease is contained. As I indicated, we only have 79 cases, and we continue to monitor this vigorously. In terms of testing, like I indicated, we are testing at 6 sites, and these are mainly government, but we are talking to the private sector to build capacity in their private labs so that we can widen our testing and so that we can have detection at all areas in the country. The other achievement is that, as I indicated, this communication and public engagement, we engaged with the public, we engaged with the churches, we engaged with local leadership, so that the message, when it goes out to the public, is uniform. And it's presented in such a way that people would appreciate what this novel COVID-19 is, so that people are not scared, but are vigilant so that they can best address the issue and keep safe. I want to share with you my experience because I was put on quarantine for 14 days. So when you're in quarantine, you stay in your house, you don't interact with people. So the only way you get connected to other people is through technology. which I'll talk to in terms of something that we managed to leverage on as we are dealing with the pandemic. But another key thing is the coordination. It was much easier to coordinate all the activities. And I must also add that the international community, in particular, the WHO, was very instrumental in getting us to test, and they continue to be instrumental. We've also had very generous people the world over who donated PPEs, which were in short supply, I must say. The NGOs within country were also, they also came on board, donated. Government set up a COVID-19 relief fund, which people continue to contribute their hard-earned money. In terms of emerging challenges, like I indicated, our greatest risk is on the imported cases, especially those bringing in supplies into the country. And then, of course, the limited access to supplies. There are very few manufacturing in the world, and everybody was going there. And this, for the first time in a long time, we had a pandemic. So everybody around the world was affected by this COVID-19. So we are all queuing up for the same resources, PPEs, reagents for testing. Inside the country, one of the challenges that we had was shortage of blood in our blood bank. They really tanked our blood supplies. We were not really meeting the targets pre-COVID, and we were hit hard in terms of blood supply in our blood banks. We also, because people were confined to their houses, we had restrictions on alcohol sale, tobacco sales. So we had people with withdrawal symptoms, so craving for tobacco and some for alcohol. We had also a bit of reports on gender-based violence, as well as incidents of crowding, which were really discouraging because social distancing was the way we were going. We were really trying to keep those 1 to 2 meter distance between ourselves. And of course, we had disruption in the provision of our health services. If I may give an example, dentistry services were curtailed. We only did emergency dentistry work, and even surgeries, doctors had to really look into how we can minimize them so that we don't have overcrowding in hospitals. And the other challenge that we had was the influx of substandard commodities, because these supplies were in demand. So people were, unscrupulous people went out to come with things that were getting us in trouble. But of course, we were very lucky because we have a very strong police service that really helped us in that regard. In terms of way forward, we continue to strengthen our healthcare system. Like I indicated, we prepared isolation facilities across the country and equipping those facilities, as well as training people to better deal with this pandemic. And I think as a way forward, we continue to expand testing so that everybody everywhere, if they need to test, they could test. And our target is to be able to test at least 10,000 people a day. And I indicated earlier that we really encourage the private sector to partake in the testing. And the other key things that I started off with, which are mundane but extremely important, was adherence to our protocols, simple washing of hands, wearing of masks, and social distancing. And in this one, our president actually demonstrated how you do hand washing, and he also did a mask challenge. So he was demonstrating how to wear a mask and handed it over to other ministers to really show his commitment and his cabinet's commitment to fighting this pandemic. Going forward, what we've learned from this adversity is that we need to really ramp up our research and development. And a lot of research institutions in Botswana have really become more creative. And I think we owe this to the adversity of the COVID-19. So people were very creative. They came up with hand sanitizers, face shields that ordinarily we would have to order from outside the country. So this really helped us. And we also have people working in research. We are looking at traditional medicines and how they can be used in the management and treatment of COVID-19. But of course, I must emphasize on traditional medicines, protocols will be followed, the research protocols will be followed to ensure that what is purported to be working works. And also exploring of manufacturing of PPEs in the country. We have a research institution here called BITRI in the University of Botswana, and other universities in the country who are now developing personal protective equipment. We've also strengthened the registration and regulation of drugs and medicines. So we have Botswana Medicines Regulatory Authority that works around the clock to ensure that all our medicines are registered. Those are some of the way forward that we've been undertaking as a country. In conclusion, I think this is the most important part of my presentation, because we wouldn't have been successful and we wouldn't continue to be successful in terms of how we deal with COVID-19 if we did not have the committed health workforce, the clinicians, the nurses, the cleaners, the drivers. Everybody came to the party and ensured that we were in this together. We had dedicated people with goodwill and who served their country with utmost diligence. And these people, I'm very proud to say they are true patriots and their relentless pursuit of excellence in everything that they do, despite the limited resources. And I want to say to them from the bottom of my heart, thank you very much for putting your country first, because this is the only country that we have. In conclusion, I also want to say that this pandemic, terrible as it is, brought us together, brought families together, made us innovative. And I think being together will put us in good stead to fight this pandemic. And while at the beginning we said people shouldn't shake hands, shouldn't hug, shouldn't have parties, we have faith that there will come a time when we would have defeated COVID-19 and we could shake hands, hug, celebrate, as we've always done as Botswana. And I know this together, with no doubt, we'll be able to achieve in the not so distant future. I thank you very much for your attention, and I look forward to engaging with you more as we delve deeper into this subject matter. I thank you very much.
Thank you so much, Honorable Minister, for that great presentation. I think now we can go to question and answers, but first, let the Minister address some of the questions that were forwarded to him. Some of the questions, he actually addressed them during the presentation, so he's going to only touch base on those that were somehow not addressed during the presentation.
Yeah, one of the questions that I get is the plans to test frontline workers. I think everything is on the table, but I must say the most important thing is protecting them from getting infected. As I indicated, we are expanding our testing capacities to about 10,000. And I think our frontline workers, first, they must be protected and they must have access to testing every time they need to be tested. I think that is extremely important. As I indicated, these are dedicated people who are separated from their families to make sure that they protect the population. And I want to just quote what one of the health workers said. He said, and I quote, "We want to die for you, but we don't want to die with you," close quotes. And I think for me, when a health worker says something like that, it shows true commitment to the cause. And that is why this government is committed to doing everything that it can do to ensure that the workforce is protected. If ever they needed to be tested, they will be tested. The other question is how are we to counter possible second phase of COVID-19 predicted by the WHO? I think when you look the world over, instead of in China, there was that first wave, and there's evidence that there's another wave that is coming. In the Americas, they also, they're right at the height of the wave, the first wave. In our neighbor, South Africa, they're also right there at the top. In Botswana, we've been very lucky. And I think the luck is attributable to our efforts, especially for the frontline workers and the leadership of the country to ensure that we minimize and the curve is flattened. God forbid we were to have a second wave, I think we'll just double our efforts. And I'm quite confident with the workforce that we have. If we were to have that second wave, we'll manage it with the highest degree of diligence. And I'm confident with the people here in Botswana who are working around the clock on this one. And I'm also confident in Botswana that they will adhere to the protocols, especially the simple ones, the social distancing, the washing of hands, and reporting. We have a dedicated line where people, and this afternoon I visited the call center and I interacted with the population, and they shared with me their experiences and how we can improve on the systems. And these improvements, they really help us in the event we have a second wave. Can Botswana form a national cabinet comprising of ministers and leaders of district council as an intergovernmental forum? We've already done that because we interact at cabinet, at the district level, throughout the administration levels of this country. There is that relationship and there's a feedback mechanisms that we have. So everything that happens in the district is reported to the highest level of government. As I'm speaking to you now, His Honor the Vice President is visiting the country, and he's in the Central District interacting with the traditional leaderships, the churches, the officials in the districts, just to ensure that we are all on the same page in terms of how we deal with COVID-19. The other question is, the nurses being brought into the prevention strategy team. I think everybody's involved. We have the National Task Force, and at that level, as minister, I sit there representing the health sector, and their officials accompany me to that, and we always give feedback. This morning, I had a meeting with the health sector, especially the private sector, where they gave advice on how they believed we could deal with this COVID-19 and the role that they can play. You don't necessarily have to be in the coordination team to have an active role in terms of managing COVID-19. You could be playing an advisory role or be actively involved in the management and giving feedback onto the system and the best way to improve the way we do things. Do we have enough PPEs for health facilities? This is a recurring question. I also want to ask that question. But the truth of the matter is, we do our utmost to make available PPEs to our frontline workers. And we've actually given an advisory that you don't need to be using, for example, N95 masks when you're not in the front line. So people are very creative. They are sewing their own masks. Actually, my mask was sewn. So we try to be innovative in that space so that we leave the most critical PPEs for our frontline workers. And I visited a clinic this afternoon, one of the local clinics, and I was just going there to check if they had PPEs and to interact with them to see how they were keeping up. And they're working very hard with the limited resources. But maybe the question to the answer is we can never have enough, but we're always looking for more. And we are doing the best with the little that we have. The other questions is, can you clarify what our actual testing capacity is and what happened with the suspected cases versus confirmed cases at GPH? Well, I'm not going to delve deep into this thing because it is a subject of investigation. GPH, for those who are not from Botswana, it's a private hospital where we had an eruption of cases. So we had to close it down, undertake an investigation to ensure that we don't have a community spread. And this is still under investigation. And I would rather not delve into it until the investigation is complete. Psychosocial support. I think that is extremely important. I got a call 2 weeks ago, and this is a gentle lady from the University of Botswana, a local university, and she asked a simple question. She said, Minister, how are you doing? And I thought that was the kindest question that I received in a while. How are you doing? And that's what I do. Every opportunity that I get, I interact with officials and the frontline workers and ask them how they are doing. Because sometimes that's all they need. How are you doing and how can we help you? And sometimes when you interact with them, that's when you get all these creative ways of managing this COVID-19. And I want to say that if it wasn't for this committed workforce, we wouldn't be where we are. And we'll offer them all the support that the government can muster, psychosocial support, and all the other support that we can give to them. So we are doing everything that we can to support them psychologically so that as they deal with this very difficult task, they are mentally stable and they are able to deliver on what they put themselves out to deliver on. I'm going to take the last one. What opportunities has the COVID-19 pandemic presented for Botswana health system and will be carried forward? I think this one is a very important one. I think we are now going to, I talked about innovation. People have been innovative, but specifically to the health sector, I think we're going to now leverage more on technology. I think I remember the days when I was in quarantine. I had meetings. We are having meetings today, and we didn't have to travel. So I think we'll leverage on technology. We need to really work on getting telemedicine running so that we could use it so that the congestion at hospitals could be reduced. We could manage diseases much better without physical interaction. I think that is extremely important. We could also, in terms of getting supplies, we no longer have to physically go to places. We use technology to look at orders and deliver them. And I know there are people working on drones, which can deliver medicines to far-to-reach places. I think those are some of the small things that we could really leverage on. And thanks to COVID, I mean, it's a terrible disease, don't get me wrong, but it brought the best out of us. And I think sometimes when these adversities hit us, sometimes they hit us for a good reason, to give us a wake-up call. At the very beginning of this pandemic, somebody said, I don't remember saying it, he said, the world is out of its comfort zone, so we better get on with it and make the best out of it. That is my take on it. I thank you very much.
Okay, thank you, Honorable Minister. He did address most of these questions. Actually, he addressed all the questions, and I think, Minister, can I just open for two direct questions?
Oh, yes.
So we are going to take about 2 questions from the audience. Anyone with a burning question, just 2, because we have to end the session by exactly 5 p.m. because the minister has to go. Anyone with a burning question? No, close. I don't see him.
Ask them they can unmute themselves.
You can unmute yourself.
Yes, can I ask?
Yes, please.
Yes, thank you very much. My name is Abia. Thank you, Minister. You talked about research. I also wanted to ask on research around the experiences on health literacy in terms of the community understanding the messages, and perhaps share with us how Botswana responded in taking up the messages on COVID-19, whether we have invested enough to be able to say, indeed, part of the success came from our community. Thank you.
Okay, I didn't get the name, but I suspect he said Adia. It sounds like a familiar name.
Yeah, it does.
Health literacy, I think, as I indicated, as part of our plan was to communicate to the public. And we're not only communicating to the literate people, we were packaging messages such that people would understand it. And I want to give a very mundane example. There was a young boy who recited a poem. And the way he recited a poem, he covered everything from washing hands, from what corona is, how it can be prevented, from staying home. And one of the interesting things that he says in his poem is, the virus does not move, we move, so stay home. I thought that was profound. And I thought, you were asking about literacy, and that just talks to literacy. They understood what they needed to do. And to just buttress their understanding, they actually turned it into a poem. In Setswana, in our culture, that's where you communicate most. And that's when you communicate unguarded. But in terms of the people's response, I'll give you my experience. I'll talk to the research, but I just want to speak from the heart. As I walk, sometimes I take walks and I'm wearing my mask. And when you're wearing a mask, nobody knows who you are. So you can get away with, Abia would know if you owe someone, if you have a mask on and they walk past you, you breathe a sigh of relief. But in any case, the point I wanted to drive is, as I was walking and I found a few guys, young people without a mask. And I said, where's your mask? They didn't ask questions. They immediately reached for their mask and wore their mask. And I thought that was profound. They didn't ask me, who are you to tell me to wear a mask? That talks to literacy, that people understood the message. And I think we'll continue drumming up this message so that people continue not to let their guard down. We need to continue to be resilient. And the biggest investment is in educating people on how to prevent the spread of COVID-19. You talked about research. I think that people who are working around the clock, as you're aware, in Botswana, research is regulated and they have to come up with proposals, submit it for a permit so they can undertake research. And I know of a few people who are working on this, and we are hopeful that there will be lessons learned from Botswana, because in the region we have one of the lowest COVID-19 cases. And we have one of the fastest response, I think. And even though that can be improved, it's one of those that people are very comfortable with. I had a call this morning with the WHO regional director this morning, and she was just wanted to tell us how delighted she was that Botswana was working very hard to try to contain the COVID-19. So there is research that is on the pipeline, and we hope that the findings from the research will bring learnings from Botswana, and we hope in the future people will be reading papers about Botswana on how we responded to COVID-19. And His Excellency the President is also actively engaged in the region with his counterparts to ensure that we get all the necessary supplies that we need to fight this COVID-19. I hope I answered the question, Mr. Swak.
Okay, thank you for that. But also, we have a Deputy Permanent Secretary for Health Policy Research and Development here. You'll also want to add something in relation to the question that was asked by Mr. Stebak.
No, I think, thank you very much, and good afternoon, everyone. I think the Minister has already addressed what I wanted to actually talk to. Basically, just to confirm that indeed, we have received, or the HRDC has received, a few protocols for review and for approval, exactly on the area that you asked about, the KABP studies, the knowledge, attitude, and behavior practices. So we have about 3 studies that are ongoing, and these are online. We are basically awaiting results of those studies, and I think we'll share, or they will be shared once the studies are completed. Thank you very much. I just wanted to...
I think we can take one more question.
Yeah.
Thank you. One more question before we close. One more question.
Can I ask a question? Can I ask?
Please.
Hello?
Hello, go ahead.
Yes, I wanted to know how the Ministry of Health is engaging private mental health providers.
No.
And I'm asking that, hello?
Yes, we can hear you. Go ahead.
Okay, and I'm asking that question because I'm a psychologist that is practicing in the private sector. And when I share notes with those who are in the government sector, their caseload is not as high as what my caseload has been. So I'm wondering how we can create a platform where we can share notes.
Thank you. But may we know, Prokopalina, we want to know who we are talking to.
Emma.
Emma, thank you.
Thank you very much. I think mental health is extremely important, especially when you're dealing with a virus of this magnitude. And I have personally received calls from mental health practitioners at the University of Botswana and some in the private practice, offering free service to the frontline workers. And as I indicated in my presentation, I even got a call, and the call simply asked, "How are you?" And I said, what am I supposed to answer to this one? But anyway, she took me down the road to really get me to appreciate what we are dealing with and the impact it could have on our mental health. And she really counseled me, I must say. So I think our doors are ever open to engage with the mental health practitioners in the country. Like I indicated, this morning we met with the sub-sector on health that reports to the high-level consultative committee of the country. And these are some of the issues that we discussed. And they are a conduit through which we can engage with different sectors in the healthcare systems to see how best they could come to the party in terms of assisting us in dealing with this pandemic. We've also I think in March, floated a call for proposals for all healthcare providers to give proposals on what they can offer the Ministry of Health. And that was in view of what we were dealing with. We were not only restrictive to certain cadres, we opened it up so that everybody can respond. But like I indicated, our doors are open to engage and to see how the private sector can assist us. And I note that you say your caseload is quite bloated. I think we need to share those experiences so that we know how to best deal with these issues. Because sometimes people don't just readily tell you that they are under mental stress until you really sit with them and try to understand how they are. And I think the key question there is how they are. The other thing that I want to talk to that we are doing here at the Ministry of Health, it's a campaign that we're running. We call it a human face. Give your service a human face. Do unto others as you'd want them to do unto you. For us, that is of critical importance. And I think, Melissa, as you talk to mental health, these things actually affect you mentally if you don't get the best service that a service provider can give. So that's why we call this the human face. So when you go on Facebook, we just say #human_face. And when you unpack it, like I said, is do unto people as you would want them to do unto you. So if you are a service provider, remember, one day you'll be the recipient of the service. How would you want to receive it? So mental health is extremely important, and we welcome any engagement from the private sector to help us deal with this better. I thank you.
Can the Honorable Minister take one more, please?
If it's really, really burning, I'll take it.
My name is Dr. Selayelo. Thank you very much, Honorable Minister. I'm sorry I joined late. Maybe you might have addressed this, but I really appreciate how our government responded to the entire problem that we had at hand. And I like the way the private sector came to on board, especially for contributions towards the COVID-19. But by any case, following up the issue of research, is there a possibility that the government can put aside a budget specifically for research, and not necessarily because people are into it because it's their job first? And then the second issue is that can you, in your capacity, maybe even post-COVID, have a way of calling the private sector on board so that they can support research in the same way that I've seen them contributing towards COVID? And the last one was that I had posted was, is there any, do we have any clinical reason of why our cases seem to be non-symptomatic mostly? Thank you, Honorable Minister.
Thank you very much. Let me start with the last one first. I think it's the easiest one. Non-symptomatic case. I mean, this is a new disease, and there are many permutations out there on who is most affected, how they are affected. As you are aware, I mean, the literature is littered with information to the effect that it tends to affect older people more than younger people. If you look at the age that have been affected in Botswana is between 15 and 55. Very few people over 60. So who knows, that could also be why that is the case. And also our population pyramid is bulged. We have a lot more younger people under the age of 30. So that could also have a role. But this is an evolving story because now there's emergence of cases of 2-year-olds and much younger people. So we're just learning. And I must say that the one thing that we could do is to prevent. And when we have cases, isolate and treat before they become very unwell. So that we don't get to a stage where people are being managed in critical care. So I think it is the response speed that is also helpful, because if I may give you an example, when we had this scare last week, we immediately knew how many people could have been affected. Over 4,000 people could have been affected. And we sprang to action because we have a tracing team that just went out and made sure that these people were quarantined, tested, and cleared. So I think the speed of the response is critical. In terms of research and development and budget, in Botswana, we have the Botswana Innovation, which is pretty much a research and development fund. And I think people can tap onto that fund to undertake research. And the universities, you must understand that even though you indicated that we do research because it's our work, universities throughout this country, they actually had to be very innovative and responsive in terms of their research and development, responsive to the pandemic that we're dealing with. So I think you are right in saying that we should make money available. And I think constrained as the budgets are, we should find an avenue to create that pot of money where research and development could flourish. And we call on the private sector to play in that space to allow for the research and development to take place. If you look at all the vaccines research the world over, they're done by the private sector. So I think, yes, the private sector should come to the party in terms of research and development. I thank you.
Okay, thank you. Let me hand over to Dr. Malink, who is the Director of Global Health, of Rutgers Global Health Institute, to say a word before we close. Dr. Malink.
Yes, thank you very much. Thank you, Dr. Hansi. I wanted to just give my vote of thanks to the minister and in a moment to the co-sponsors. We were very happy when Minister Dr. Kwape took on the role of minister at Rutgers University, except for one thing. He had to give up his research project. He had to give up his research project with Dr. Saki, our nutritionist, because both conflict, but also he's too busy to do his research. He's a nutritional epidemiologist. But I would like to thank him for marking this, our 10th joint webinar on COVID. And I also would like to thank Dr. Hansi Tsitsemoho and the rest of the Ministry of Health and Wellness. A big thanks to the University of Botswana, of course, and the Botswana-Harvard partnership and the other partners who have come together again and volunteered and put these webinars together. And I think they're available really for the region, but as was noted, they're available on the YouTube channel. So thank you so much, Minister, and thank you for your words and insights. And I think we're all proud to be part of this effort against the pandemic. And thank you so much.
Thank you so much. We have come to the end of today's webinar session. We are going to see you again on Thursday, same time. But please don't forget to fill out the webinar survey. We really need your input. Tell us what to improve or the topics that you want us to present. And I know that we couldn't address all your questions, but I will see how we can address some of those questions like in the next session. So you can email your questions and then we see how we can get you the responses. Thank you all.